Here I am performing an exam on Nessie before she goes under anaesthetic. So she had a good pulse, it was strong, her heart rate was around 110 beats per minute. It was hard to get a respiratory rate as she was panting. Her temperature read at 38.2 degrees Celsius. Body score was 2 as she is a little underweight. Her CRT is 1 second. Her mucous membrane is pink. Her teeth were a little smelly and there was a tartar build-up on her teeth. Her eyes were a bit gunky and there was dry discharge around them. Her ears were good. There was no discharge or smell. Her nose was good. There was no discharge. Her hair was thin and there was a bump on her back, but her owners weren't worried about that. And as I was feeling over her, she was not in any pain or any discomfort. I would give her an ASA class of 1. Here I'm making sure we have enough Betamox, Loxicom, ACE and Atrocite for Nessie today for her surgery. I'll give in Nessie her pre-med injection, which is 0.2 mils Atrocite and 0.2 mils of ACE. The vet directed me to give her this amount for her pre-medication. And I'm injecting it in the scruff of her neck. Setting up for surgery, I'm going to put a towel on our surgery table for heat support. I'm going to turn on the surgery light, making sure it's all working properly, selecting the ET tube sizes, which I chose 4.5, 5 and 5.5 for our patient. We ended up using size 5. I'm now making sure the bag is all connected properly. Grabbing the kit we'll be using and the drape, I used a cat spay kit and a medium drape, medium hole. Grabbing a size 20 scalpel blade, sterile, and also sterile gloves for our surgeon. I'm now selecting our catheter equipment, a size 22 gauge, vet wrap and soft band. And that's the tape we'll be using as well. I'm now making sure we have enough oxygen in the tank, checking our monitoring equipment, making sure our ISO is full. And I have chosen a rebreathing circuit for this patient. I have selected clippers and I'm putting them at the anaesthetic machine. Now starting surgery on Nessie. Induction is a face mask, ISO level on 5 and oxygen on 2. She's held in the sternal recompenses position. Then once she's under, we'll then put her on her side, intubate her with a size 5 ET tube and then connect her to the anaesthetic machine. I've tied the ET tube in by a shoelace and blowing up the cuff with a syringe. We have then shaved the area and now I'm going to clean it with Chlorhex and iodine, getting ready for the surgery. I'm unable to check her temperature throughout the surgery due to it being in the surgical sterile field, but I'm continuously checking her heart rate, respiratory rate, mucous membrane and CRT, and her reflexes and her jaw tone. Now that the surgery is completed, we're going to turn her off the anaesthetic machine, leave her on the oxygen. I'm going to clean the surgical area with Chlorhex, wiping away from the incision line, so no blood will stay on the stitches. I'm then going to monitor her until she wakes up and all her vital signs are back to normal and she can support herself.